I'm Larysa Dyrszka, and I'll be speaking about the process of health impact assessment in land use decisions, and specifically on the extraction of shale gas. Before discussing potential health impacts in gas drilling, I'd like to briefly review the factors which contribute to overall health. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health is influenced by a broad range of both individual and collective factors, and their interactions, of course, and these factors are referred to as the determinants of health. The main determinants are factors that impact the social and physical environments. So there are two tasks: protecting the physical environment and proactive investment in improving the social determinants, which will translate into better health equity, improved population health, and fewer healthcare dollars spent in the future. As noted in this Dahlgren diagram, the factors determining health include age, sex, constitutional or genetic factors, plus availability of medical care. These in turn are influenced by individual behaviors, which are shaped by the conditions and opportunities in the community and in the home. And then there's another umbrella, that's the socioeconomic, cultural, and environmental conditions. The impact from each of these determinants varies, but research estimates that in general, the health of a population depends principally on the combined influence of the social environment and the physical environment. And this accounts for more than half of the total influence on population health. And that's followed by to a progressively lesser extent by health behaviors, medical care, and lastly, the genes and biology. This presentation will focus on those determinants of health that are related to the changes in the social and physical environments. Although this module is on health-oriented planning and decision-making, I'm including a very brief one-slide review of shale gas extraction, since this is the land use decision that we're considering. And please also see Dr. Ingrafia's in-depth presentation in Module 1. High-volume slick water horizontal hydraulic fracturing is a new application of an old technology. It's called unconventional gas drilling because of the very deep layers it aims to reach, the extreme method of extraction, and how large the process is. The layers unconventional drilling aims to reach are a mile or so down in tight shale formations, rather than the pockets of easy-to-access gas of conventional drilling. And fracking is just one part of the process, and it's the one that results in the creation of fractures in rocks. It's also the part that has enabled unconventional drilling. The fracturing is done from a well bore drilled into reservoir rock formations to increase the rate and ultimate recovery of oil and natural gas. The process uses 3 to 7 million gallons of water, sand, and chemicals blasted at high pressures. This enables the recovery of natural gas and oil from low porosity and low permeability tight shale formations. The fracking itself usually only takes a short time compared to the drilling and production phases of drilling, of gas extraction. I'll be speaking about the entire process of gas extraction and production from cradle to grave because potential negative health impacts have been observed during all the steps. So for example, during the mining of silica sand, there's also water withdrawal, which can cause the depletion of the water supply due to exceptionally large amounts of water needed for each well. In transport, there can be spills of chemicals or traffic accidents. During drilling, aquifers can become contaminated with methane due to lack of adequate casing or due to casing failure. Air pollution with ozone production from diesel-driven transport vehicles can occur, and then during drilling, venting, flaring, and processing, and also at compressor stations, we've seen air pollution. Disposal of waste is a problem in New York State, as there's no wastewater treatment facility able to handle it. Noise pollution occurs. And finally, people can experience psychological stress during the entire process if they're concerned about the potential loss of home value, loss of water, and potential health impacts. The following slides will show the extent of gas exploration. There are about 7 gas-bearing shale layers in New York State which can be drilled. On the left is the Marcellus Shale in New York, and on the right is the Utica Shale extent. And there are shale deposits in over 30 states in the United States. In preliminary studies, Schlumberger Oilfield Services have identified 688 different shales in 142 basins worldwide. Looking at all these shale formations, it appears that all continents have shale gas, and so this is a global issue. Infrastructure is needed to transport the gas via pipelines and compressors, and these need to be built. On the left are the pipelines, and on the right, the red dots represent compressor stations. These slides, which I've just quickly gone through, give an overview of the potential extent of shale gases extraction impact globally. And more specifically, who might be affected by shale gas exploration? The process starts with the mining of sand and withdrawing the water. So first it might include people who mine the silica sand or live nearby, and the potential impact is silicosis. Communities in the West where there are record droughts compete for water with drilling companies. And then people in areas where gas drilling occurs with the possibility of stress from rapid industrialization, traffic accidents, crime, potential air and water pollution. And people near pipelines and compressors because of the possibility of explosions and air pollution. People who receive their water from gas drilling areas if it becomes polluted, and those who are downwind of gas producing areas from air pollution. With respect to the scope of impacts, it's important to recognize that potential impacts could be both positive, for example, economic gains in terms of income, employment, and energy production, and it could be negative, for example, increase in greenhouse gases, negative impacts on existing economy like tourism, fishing and hunting, farming. There could be ecosystem damage, radiation exposure, and even earthquake activity. So it's important to fully evaluate both positive and negative impacts. The process I will shortly describe, the health impact assessment, should include a full assessment of all the potential impacts, both positive and negative, which are associated with any kind of development, and specifically this one. So what are some of the impacts that may be associated with health effects? In her presentation at the recent Institute of Medicine conference in Washington, Dr. Roxana Witter of Colorado School of Public Health raised concerns that if stressors on the community are not addressed, there likely will be an impact on the health of the population. There will be increased traffic, which may benefit local shop owners such as diners, gas stations, motels, but there's also the likelihood that there will be negative impacts, such as air pollution from the traffic, accidents, road wear and tear, and transportation infrastructure demands. So road and transportation issues must be addressed. The Centers for Disease Control tell us that transportation accidents are the leading cause of occupational fatalities in the mining industry, with an on-the-job fatality rate 8 times higher than the rate for all U.S. workers. And also, the younger the worker is, they tell us, the greater the likelihood of becoming a victim of these kinds of fatalities. Workers in the oil and gas industry are part of the community, and whatever happens to them will have an impact on their families and on their community. Silica is the sand that's used in fracking, and it's a problem. The National Institute for Occupational Safety and Health, also known as NIOSH, identified exposure to silica, crystalline silica during hydraulic fracturing as the most significant known health hazard to workers. Inhalation of fine dusts of crystalline silica can cause silicosis, and that's an incurable, but it's a preventable lung disease. It's an occupational lung carcinogen, and there's evidence that inhaling silica dust causes chronic obstructive pulmonary disease, chronic renal disease, and possibly autoimmune diseases. And people with silicosis are also at higher risk for tuberculosis. More on the workers, it's been also noted that unhealthy behaviors such as drug abuse and crime may accompany the influx of new workers, and the community has to be prepared with adequate health facilities and policing. New oil and gas workers have money, and they make money, but many of them are from out of state, and when they're paid, often the money is sent back to their families in their home state. So the host state doesn't benefit as much as one would presume. Housing becomes unaffordable for some of the residents when workers arrive in a community, mostly because landlords know that these workers will pay a higher rent. So while the landlord may benefit, the family that was evicted will not. No one benefits from water contamination, but that documentation has been hard to come by because homeowners must sign a non-disclosure agreement with the gas company in order to receive an alternate source of potable water. Homes with water contamination may become unmarketable and families may become displaced, and this also unravels the social and community networks. Environmental and social justice concerns, such as vulnerable populations and equality, are required considerations by presidential executive order. Yet, gas drilling frequently occurs in areas which have underserved and rural populations and near vulnerable group activities, such as schools and hospitals. People who are already under stress from an underlying illness or poor socioeconomic status, or because they're simply very young or very old, and therefore vulnerable populations, suffer environmental and societal impacts less well than people who are not so stressed. The major influences on population health, and therefore the main determinants of health, are community impacts, but also one's environment, the physical environment. If you protect the environment, you will protect human health. With the environmental impacts, there will be positive and negative effects, but that needs to be parsed out and with special consideration of the most vulnerable. The major stressors on health which have been found to be due to, which have been observed, have been due to the following environmental impacts, and this is not inclusive of all of the potential impacts, but these are the major ones. Air pollution, water contamination, the chemical mix, radiation, and waste. And in the following slides, I'll explain in a little bit more detail. So are there any positive impacts on the air from shale gas? Well, yes, if you look at burning gas as opposed to coal or dirty oil, and if you ignore the extraction, the processing, and the transport of the gas. So it's important to study the full life cycle of any industry. I would call your attention to two recent peer-reviewed articles, one by Mackenzie and her colleagues at the University of Colorado School of Public Health, and the other from Dr. Theo Colburn and her colleagues at the Endocrine Disruption Exchange also in Colorado. The study by Dr. Colburn, just released last month, tested ambient air before and after the commencement of drilling and fracking operations in Colorado. Industry's equipment was state-of-the-art. And they used a completely closed loop system, no open pits or open mixing of chemicals were used, and yet once drilling operations started, 44 air pollutants were detected in fairly large amounts in the backyard of a house located just a little over half a mile away from the well pad. And in the Mackenzie study, the authors found that residents living less than or equal to half a mile from wells were at greater risk for health effects from natural gas development than residents living more than a half mile from wells. Subchronic exposures to the air pollutants during well completion activities present the greatest potential for health effects, with benzene as the major contributor to the risk. The report from the National Oceanographic and Atmospheric Administration discusses a study in Utah on high-level ozone during the winter, which is considered a meteorological anomaly. Ground-level ozone formed in the presence of sunlight and air pollutants such as particulate matter 2.5 and 10 nitrogen oxides, sulfur dioxide, and carbon monoxide, and emissions of hazardous air pollutants like benzene, toluene, ethylbenzene, and xylene, and formaldehyde, exceeded federal health standards in northeast Utah's Wichita Basin for almost a month last winter. On a February day, the 8-hour average was 146 parts per billion, nearly twice the federal standard and potentially dangerous to even healthy adults to breathe. And that puts the Wichita Basin in the same category as the worst ozone locations in the country. And in Wyoming, EPA monitors registered a March ozone reading of 124 parts per billion, higher than the worst ozone levels recorded that year in Los Angeles. Wyoming and Utah officials have noted that ozone precursor pollutants, the nitrogen oxides and the volatile organic compounds, are emitted in large quantities by the region's oil and natural gas drillers. And they recognize that the main contributor to the emissions is the oil and gas industry. High concentrations of ozone can trigger asthma attacks and inflame conditions for people with bronchitis and emphysema and other respiratory ailments. Children are especially vulnerable to the effects of ozone because their lungs continue to grow and enlarge until about age 18. Plus, they breathe faster and are closer to the ground. As they mature in the presence of ozone, alveolar production is reduced, and the result of chronic ozone exposure can be brittle lungs like those of an elderly adult. Air pollution has also been shown to be associated with neurodevelopmental disorders, lower IQ in babies born to mothers with polycyclic aromatic hydrocarbon exposure during pregnancy, and learning disorders in exposed children. And the World Health Organization has now classified diesel exhaust as a definite carcinogen, raising additional concerns for workers and other vulnerable groups exposed to diesel exhaust. At the end of the presentation, I have references for the studies I mention here. Whether gas drilling has contaminated water sources is the subject of several legal cases as well as research, and those are also in the references. There's growing evidence that water has become contaminated when gas drilling occurs nearby. In the peer-reviewed paper on methane migration, Osborne and his colleagues at Duke University wrote that in aquifers overlying the Marcellus and Utica shale formations of northeastern Pennsylvania and upstate New York, they have documented systematic evidence for explosive levels of methane in drinking water, and this was associated with shale gas extraction. In another study, Warner and his colleagues at Duke and Cal State just published this paper where they state that the presence of these fluids, which they refer to as the briny fluids, suggests conductive pathways and specific geostructural and hydrodynamic regimes in northeastern Pennsylvania that are at increased risk for contamination of shallow drinking water resources, particularly by fugitive gases. And those of us who've been following this issue closely know of many cases of illness near gas drilling operations. Most are called anecdotes because pathways of exposure have not been identified, either because the complaints are not investigated by those tasked with public health, or records are sealed through non-disclosure agreements, or sometimes both. In their recent paper, Bamberger and Oswald researched several cases where chemicals associated with drilling were implicated in negative health outcomes. One of their several cases that they described was the death of 17 cows in Louisiana within 1 hour from direct exposure to hydraulic fracturing fluid. The final necropsy report listed the most likely cause of death as respiratory failure with circulatory collapse. The hydraulic fracturing fluid contained petroleum hydrocarbons and quaternary ammonium compounds, plus other toxins. 2 additional cases provided inadvertent control experiments, since herds of cows were kept in different pastures. In one sentence, the cows exposed to gas drilling chemicals had significantly more deaths, stillbirths, and congenital malformations. Their study illustrates not only several possible links between gas drilling and negative health effects, but also the difficulties associated with conducting careful studies. And although not peer-reviewed, the report by Amy Mall of NRDC lists numerous additional cases of water contamination near gas drilling sites. The proprietary classification of chemicals hampers health studies, but we know it includes known or suspected carcinogens, mutagens, neurotoxins, hazardous air pollutants, and endocrine disruptors. And many of those chemicals have effects at very low doses, and that's been documented in peer-reviewed literature. Dr. Theo Colburn and her colleagues are among the authors of those papers. Just one of the hundreds of chemicals used throughout gas exploration is 2-BE, also known as 2-butoxyethanol, and also known as, one of the trade names is unifoam in the drilling industry. But it's also a component of Corexit, which was used in both the Gulf and the Exxon Valdez spills, and which the Agency for Toxic Substances and Disease Registry, ATSDR, has listed as hazardous. In this report by the World Health Organization that I note here, noise causes documented vibroacoustic disease, which can lead to heart disease, neurological, and gastrointestinal problems. For decades, we have known that the Marcellus Shale is more radioactive than other shales, and I would refer you to the paper from 1980 in my references by Gogolak. EPA Region 3 reports that radium measured as gross alpha and beta in produced waste in Pennsylvania wells is significantly higher than in other shales. And these are from more recent reports. Numbers such as radium 226 up to 16,000 picocuries per liter, alpha particles at almost 19,000 picocuries per liter have been reported in Pennsylvania shale by the EPA. The International Atomic Energy Agency has recommendations regarding radioactivity in oil and gas mining sites, and most countries which are members adhere to the recommendations. The US is a member, but has instead exempted from federal oversight the material that comes from downhole, including the fluid waste, sludge, drill cuttings and pipe, and in many cases, radioactive materials are included there. This is how that particular exemption came to pass. As a result of EPA's proposals in 1978, Congress exempted oil and gas waste from the RCRA, which is Resource Conservation and Recovery Act, Subtitle C, Hazardous Waste Regulations, pending a study and regulatory determination by EPA. And then in 1988, EPA issued the regulatory determination stating that control of oil and gas exploration and production waste under RCRA Subtitle C is not warranted. So, E&P, oil and gas exploration and production wastes, are exempt from these regulations. Here's a simple rule of thumb that can be used to determine if E&P exploration and production waste is exempt or non-exempt from RCRA Subtitle C. You can ask two questions. Has the waste come from downhole? In other words, was it brought to the surface during oil and gas exploration and production operations? And has the waste otherwise been generated by contact with the oil and gas production stream during the removal of produced water or other contaminants from the product? And if the answer is yes to either question, then the waste is likely considered exempt from RCRA Subtitle C regulations. It's therefore left up to states to regulate waste, including radioactive waste. And the short answer to the question is do states adequately regulate waste, including the radioactive materials, is no. The radioactive elements found in Marcellus shales includes radium, uranium, thorium, and also radon. You might know that radon is the leading cause of lung cancer among non-smokers and the second leading cause of cancer among smokers. 21,000 lung cancer deaths per year on a nationwide basis are attributed to radon exposure, and this is per the Environmental Protection Agency. Radon and its radioactive decay products enter the body primarily through inhalation. Most of the radon is exhaled prior to radioactive decay, but some of the solid radioactive polonium and lead remain in the lungs, and those are the two radioactive materials that actually cause the cancer. Although 0 is the only safe level for radon exposure, EPA urges mitigation for anyone with indoor levels of 4 picocuries per liter. Areas overlying the Marcellus Shale have high indoor radon on average already. Counties in the southern tier and central New York with average radon concentration of 4 picocuries per liter, those areas shown in red, in dark red on the slide, will be at risk if exposed to radon additionally via delivered gas. Dr. Friedrich Steinhäusler, in a peer-reviewed paper, also urges protections from radon exposure for workers in the oil and gas industry. There are no provisions for the monitoring of radon in homes and schools prior to or following drilling, and workers are not wearing protective clothing, nor are they wearing dosimeters. Soluble elements have, over the past 350 million years or so, leached into the water trapped in the rock formation, creating extremely salty brine, at least 5 times, or 5 to 10 times actually, the salinity of the sea. And that's brought to the surface during gas extraction. And also brought up are hydrocarbons, which are volatile organics, such as benzene, ethylene, toluene, and xylene, as well as the radionuclides. These are hazardous materials and harmful to human health. They cause cancer, reproductive problems, and neurological issues. Shales, more than any other kind of rock, selectively trap heavy metals such as lead, arsenic, barium, strontium, chromium, and others. And when shale is fracked, these heavy metals are released and brought to the surface with the gas and produced fluids. To dispose of the waste, underground injection wells, which have been documented to cause earthquakes, soil farms, road spreading, used as de-icing and dust control, and dispersal into streams and waste via wastewater treatment plants are currently in use. But there is no wastewater treatment plant in New York that can handle the waste currently, and the other methods are simply too risky to human health. So we really have no way to dispose of the waste in New York State. And as mentioned in the previous slide, the material that comes from downhole is exempt from federal oversight, so it's up to the states to regulate. In New York, instead of considering the oil and gas waste as hazardous, it will instead be tracked and disposed of in a similar fashion as medical waste. So what can health professionals do? How can you become involved, and should you? First, assess the situation. Is there a potential for harm? The U.S. Institute of Medicine has defined the field of public health as what we do as a society to assure the conditions in which people can be healthy. So you might ask, would a health consultation be useful, and whom might you ask to do this? If there's a suspicion of harm from any chemical, an individual or a group, such as a group of physicians or an individual doctor, can initiate a petition for a health consultation by the Agency for Toxic Substances and Disease Registry. And a recommendation: be an advocate. Someone's health and life may depend on it. The medical community recently began looking more closely at this issue and asking if public health was protected. Dr. Bernard Goldstein at the Graduate School of Public Health at the University of Pittsburgh says that published epidemiologic studies relating shale gas production to health are virtually non-existent, which makes it challenging to scientifically validate the anecdotal reports that I mentioned earlier, of which there are now many. He suggests that shale gas exploration be accompanied by prospective health research, including baseline disease surveillance and environmental monitoring. That way, if clusters do appear pre- and post-drilling, data can be compared. Doctors are not routinely trained to evaluate for environmental contamination. That's not part of our medical school curriculum for the most part. So they may not ask the questions nor even be familiar with the chemicals and other possible toxins. Non-disclosure agreements initiated by industry in any cases of presumed or suspected contamination are very common. And the gas industry is exempt from oversight because of the 2005 Energy Policy Act. An Environmental Protection Agency study concluded that drilling and fracking were safe and didn't warrant further study because there was no, quote, no unequivocal evidence, end quote, of health risks. And the fluids were neither necessarily hazardous nor able to travel far underground according to the EPA study. That study, however, was not intended as a general study of hydraulic fracturing, and it was supposed to be a study only of coal bed methane deposits, and the study did not consider impacts above ground at all. Another reason that we don't know very much is because of exemptions. And these are highlights of oil and gas industry exemptions from federal statutes, and they're listed on this slide, which you can read. But very briefly, the exemptions give the oil and gas industry an unprecedented freedom from regulation by key provisions in all the major public health laws, which include the Safe Drinking Water Act, the Clean Water Act, a National Environmental Policy Act, Comprehensive Environmental Response, Compensation and Liability Act, also known as Superfund, RCRA that I mentioned earlier, the Clean Air Act, and EPCRA. So have health impacts of shale gas development been addressed in the regulatory process of the federal government and the state? Since most of the peer-reviewed literature on health impacts is scant and has only been published in the last 1 to 2 years, it's unlikely that this medical literature, health impact literature, has made its way into the state and federal regulatory system. So the federal exemptions were passed 7 years ago, and during that time the oil and gas industry has been minimally overseen, if at all, and we don't know the extent to which health or environmental impacts have occurred because they haven't been tracked. State regulations vary, but have not been inclusive of the health literature for the most part. And also doctors and public health professionals have not been at the table. Medical groups have written recently of their concerns in letters to New York State officials requesting, for example, that the document that is overseeing the gas drilling regulations be expanded to include human health impacts. And you can see some of those on the website listed here. And we also know that despite the best regulations, accidents can and will happen, and violations will occur. We also have to make sure that vulnerable populations and communities and workers are protected. And we have to insist that public health laws protect the public, not industry. We as medical professionals need all of the information, yet non-disclosure agreements are rampant and they hamper access to important information. In a case involving a family with adverse health impacts and near gas drilling operations on their land, the family sued. They settled with the company and the record was sealed. Earth Justice was joined in a Friends of the Court brief by Philadelphia Physicians for Social Responsibility, physicians, scientists, and engineers for healthy energy, and several prominent other researchers who maintain that there is a need for the information in the sealed records in the interest of public health. So only through lawsuits are we beginning to gain some access to some of this information. The State Environmental Quality Review Act, also known as SECRA in New York State, is the reason that gas drilling using high-volume slick water hydraulic fracking with horizontals is not moving ahead here. SECRA requires an analysis of environmental impacts, but it also requires that health impacts be addressed before any major land use decision can be made by any agency of government. The SGEIS, Supplemental Generic Environmental Impact Statement, which was prepared by the New York State DEC to examine these impacts, hasn't been finalized, and yet the New York State Commissioner of Health has contracted with outside experts to assess the adequacies of the state's health review. This has been done without the medical community's input and without the public understanding or knowing what this review entails. Yet the medical community in New York continues to vocally advocate for a comprehensive health impact assessment. So what is this process which can inform the policy of gas drilling in New York State and, in fact, any land use decision? The health impact assessment should be used prior to the start of any development and before promulgating regulations. It's particularly important in the case of gas exploration and production because this is the largest land use decision of our time. Health impact assessment, also called HIA, aims to identify how development induces unintended changes in the health determinants and the resulting changes in health outcomes. And it aims to recommend the best actions to prevent harm. Improving health outcomes and minimizing negative health impacts should be the goal of any land use decision. Last year, the National Research Council of the National Academy of Sciences defined and explained the use of an HIA, and that reference is listed at the back of my presentation, and it's well worth reading. Why is the health impact assessment useful? Because it elevates the role of health in decision making. It's a practical tool that can provide a structured process. It can bring both immediate and long-term health benefits, and it ensures that health dollars are used efficiently. Health impact assessments can be commissioned by local, regional, state, and national governments, also by their health or planning departments. It can be commissioned by national and international development banks and donors, by private industry, and by concerned citizens. Advocacy and leadership to address community needs has always been part of my field, pediatric medicine. The American Academy of Pediatrics, through its Community Pediatrics Training Initiative, works to ensure that all pediatricians are trained to interact with their communities, to effect change at the policy level, and ensure that patients have advocates ready and able to help them. Other medical specialties have similar initiatives and directives. Physicians witness daily the impact that our patients' communities have on their health. We have the social capital to effect change. It's incumbent upon us to use our skills to help patients, families, and communities. And we must be taught to do so effectively. HIA is unique in that health is brought into decisions and policies which may not have previously considered health implications. It involves coordination, cooperation, and communication among stakeholders, policymakers, and health professionals. It integrates best research with clinical expertise in order to make those informed decisions about the health of a community. HIA includes developing recommendations to minimize adverse health effects, and this will result in a better understanding and implementation of basic safety principles. It influences patient care because the practitioner will be more aware of a particular land use and its potential health impacts. Understanding how HIAs work and how they can inform a decision integrates medical knowledge with environmental policies. An HIA is meant to be prospective, preventive, and proactive, and it should be used as a decision support tool and is best done before a policy process or regulation is implemented. It focuses the attention of decision makers on the health consequences of policies, and it identifies vulnerable groups and stakeholders. It uses qualitative and quantitative data sources and offers recommendations for further study. If data is incomplete, and if so, it draws from available information in similar conditions, so it's fairly flexible. It has the potential to save healthcare dollars in the long run. It's really a very democratic and creative process. The major steps in conducting a health impact assessment are similar to those of an environmental impact statement and rather simple. First, you identify projects or policies for which an HIA would be useful. You gather stakeholders, you collaborate, then you scope which health effects you want to consider, the populations, and also the areas to study. During the assessment phase, you would identify how the populations may be affected. That involves a literature review, and you could also include qualitative analysis and quantitative modeling. It identifies not only the important health risks and benefits, but also their distribution among vulnerable subgroups within the population, such as children, the elderly, people with chronic illnesses, racial and ethnic groups, or those with low incomes. The HIA should be conducted in an impartial, scientific way that identifies both the risks and benefits associated with a decision. The decision makers should be comfortable with the decision being advised by this health impact assessment and should have a buy-in to this health impact assessment, but not necessarily. Assessment of health-related economic costs and benefits has not been common in health impact assessment, but that can be requested, and it may help the decision makers weigh the relative importance of identified health issues against other considerations. On the basis of the assessment, you would suggest changes to proposals to promote positive health outcomes and mitigate or eliminate adverse health effects. As the results are presented to the decision makers, the HIA practitioner can also advocate for the best course of action based on the study. The ultimate decision is of the decision maker. At the end of the presentations with the references, I've provided additional slides with a more in-depth description of the HIA process. The American Public Health Association is the oldest and most diverse organization of public health professionals in the world and has been working to improve public health since 1872. And the American Public Health Association supports HIAs. The process of HIA has been used twice in the US to inform proposed gas drilling regulations or policy, and those were in Battlement Mesa, Colorado, and in the North Slope of Alaska. This is ongoing gas development in Garfield County, Colorado, the focus of one of the HIAs related to gas drilling. And on this slide, hatches are the leased areas, and the black dots are existing gas wells. This was the plan for development in Battlement Mesa, Colorado by Antero, which is a gas drilling company. The orange lines are the boundaries of the planned unit development. The blue areas are the proposed well pads with 10 or so wells per pad, and in red is the proposed pipeline. In May of 2009, Antero Resources announced a proposed plan which would include constructing 10 well pads and drilling over 200 gas wells within the residential area of Battlement Mesa. A citizens group formed and they requested a health study from the county commissioners, and that was approved. Battlement Mesa had a city charter which was unique for Colorado, and this put gas development on hold while this study was ongoing. The Board of County Commissioners of Garfield County contracted with the Colorado School of Public Health to do the study, to do the health impact assessment, which went through 2 drafts and public comments. But the HIA was terminated while in the second draft. The investigators offered more than 70 recommendations for minimizing health impacts. The report was never finalized, primarily because community members and Antero Resources, the company behind the proposed development, disagreed over its conclusions. However, it can be found on the Battlement Mesa County website. The Battlement Mesa Health Impact Assessment focused on assessing 8 areas which they determined could be affected by gas exploration and production: air emissions, soil and water contamination, truck traffic, noise, light, vibration, kind of grouped in one category, health infrastructure, accidents and malfunctions, community wellness, and economics and employment. These are direct and indirect impacts and are all related to major determinants of health, our society and our environment. Assessment of each stressor included a review of its general impact on physical, mental, and social health, and it also included an analysis of existing environmental and health data, a characterization of the stressors' potential impact on health, and they also looked at the distribution of health impacts on vulnerable populations and on within the community and on the whole community. This table summarizes their findings and the numerical ranking of impacts on the health in Battlement Mesa. By ranking the stressors, they were able to conclude that air quality impacts are likely to produce important negative health impacts to residents throughout the community, and that was the most significant stressor. Some stressors may produce both positive and negative impacts, but they weren't of high magnitude, and so they're ranked farther down. These include stressors to community wellness, the economy, and health infrastructure. Use of health impact assessments as a tool to assess and summarize potential impacts can help regions and communities prioritize local resources and can provide them with information to protect public health. This information can also contribute to the growing body of knowledge we need on chemical and psychosocial stressors and health impacts associated with natural gas development. This sort of a study should be done before any decision on gas drilling policy is proposed, because it would give the decision makers the information needed for the most beneficial health outcome. One other health impact assessment has been done on this issue, and that was in Alaska. It was unique in that the author integrated the health impact assessment with a large federal EIS for proposed oil development on Alaska's North Slope. The request for the study came from the mayor of the borough of North Slope, and in this case, a National Environmental Policy Act, also known as NEPA, study was called for because the lands were federal and tribal. The extent of leasing is in red. Lake Teshekpuk, noted kind of in the middle top of the slide, is an area that's considered very sensitive. It has wetlands and caribou calves are born there as well, and it's an important stop for migratory birds. The study found that the preservation and sustainability of this area is important because it interacts with and contributes significantly to Inupiat health and survival. The Inupiat are the local indigenous people. The possible health outcomes if the area around Lake Teshekpuk were to be developed included increases in diabetes and related metabolic conditions as a result of dietary change, rising rates of substance abuse, domestic violence, and suicide, increased injury rates, more frequent asthma exacerbations, and increased exposure to organic pollutants, including carcinogens and endocrine disruptors. There were some potential benefits, including funding for infrastructure and health care, increased employment and income, and continued funding for existing infrastructure. But based on the sum of these findings, a series of mitigation measures were recommended. The health impact assessment was useful in the North Slope. Among other results, it was decided not to develop the sensitive Lake Teshekpuk region for at least 10 years. In addition, the Tribal Health Department has become a cooperating agency with the Bureau of Land Management on several EISs for oil and gas leasing, and they've completed HIAs that addressed not just oil and gas, but a variety of other health issues. Many of us in the health field studied the 1,500-page SGIS, the Supplemental Generic Environmental Impact Statement, and searched for reference to public health. And while the words public health were used often, there were inadequate or no public health recommendations in place for protections and no provisions for monitoring. The SGIS focuses on evaluating potential adverse environmental impacts, but not on the health impacts that might flow from these environmental impacts. DEC's position is that there will be no health impacts because permit conditions and regulations are, according to them, the most stringent in the country, although there's still information, and will prevent the environmental impact. So it's not necessary for them to examine potential pathways of exposure, for example. On this slide, on the left-hand side, is a summary of potential environmental impacts related to gas drilling which could affect human health. And on the right are the links in the SGIS where the environmental impact was mentioned. And in red, whether health impacts in general, with some specifics, were adequately addressed. In short, they were not. And let me give just one example. At the top, the air pollution and contamination of air, soil, or surface water. Air pollution from truck traffic is mentioned in several places, including Appendix 19, but it doesn't address human exposure, especially exposure of children and pregnant women. From an earlier slide, you'll recall that children and the unborn will be most negatively impacted by the air pollutants. We've noted that the word child does not appear once anywhere in the 1,500-page SGIS, even though drill rigs and wells would be allowed near schools and public buildings and near homes. Endocrine disrupting chemicals and pregnant women are not mentioned in the 2011 SGIS, and also that document contains no discussion of links or potential pathways of exposure between these factors, the air, soil, and water contamination, and human health. So how would an HIA add value to New York's gas drilling regulations? Among other information, it would include the current health literature, and it would provide for the inclusion of future research. It would include doctors, public health professionals, and scientists, and include possible exposure pathways, even if they're remote. ATSDR, the Agency for Toxic Substances and Disease Registry, defines a pathway of exposure as the route a substance takes from its source to its endpoint and how people can come into contact with it. These exposure pathways may be difficult to complete, especially when data is secret, unavailable, sealed, or not collected. And that is one area of contention and a reason that research has been hampered. But even if incomplete, these exposure pathways should be anticipated. Even the best regulations cannot prevent human error and accidents. Additionally, a health impact assessment would include direct and indirect impacts on all the determinants of human health. It would include all population groups, which is not the case currently. It would improve health outcomes as its aim and include a plan for monitoring and evaluation. Thus far, these suggestions to address human health and improve outcomes have not been included in New York State's SGIS, but the health impact assessment continues to be the process which the New York medical community is advocating for very strongly. And despite requests to the governor for a comprehensive health impact assessment from every large medical organization in New York, the process unfolding in New York is really something quite different. The Department of Health review is going forward without the opportunity for input from New York medical professionals. There's also no input requested by the state from potentially affected communities, that's stakeholders and vulnerable populations. And neither the public nor the New York medical community have seen the documents which the 3 public health experts who are from outside New York State are reviewing. It's a secret, non-transparent process. And just last week, the DEC issued revised regulations without the benefit of any health review. The potential risk to the public health from shale gas drilling are real. Peer-reviewed literature is providing sufficient reason for concern even though specific pathways are yet to be determined. There is a growing body of evidence that people living near gas drilling operations are being exposed to toxins, and potentially for future generations this is a big issue as well. And we should invoke the principle of precaution to slow down the process so that federal and state agencies and scientists and we doctors can better evaluate the risks and advise the decision makers how to proceed with shale gas development to avoid possible irreversible harm. A process called the Health Impact Assessment has been presented and is needed to determine the potential impacts on the health of New York's population. An HIA would be transparent and inclusive of all stakeholders. It would provide an assessment and recommendations similar to an EIS, and it could be included in the SGEIS. And it would provide options, such as recommended future studies, mitigations, or no action. It should inform the decision makers and the public of the health impacts, and it should be done before a decision is rendered on whether it's safe to proceed. The health profession is overwhelmingly in support of the health impact assessment as the process to inform the most significant land use decision in New York's history. Thank you.